cellulitis. This is an inflammation of the skin and subcutaneous tissues as a result of an infection. The affected area is usually painful, red, and warm to touch. It usually affects the lower legs, but can occur in any other part of the body. It is not a communicable disease, so it cannot spread from person to person, but it usually happens when there is a break in the skin. The bacteria that are usually responsible for cellulitis are the Streptococcus and Staphylococcus bacteria. This bacteria usually enters dry, broken, and flaky skin. Some risk factors include injury, surgical procedures, skin conditions such as dermatitis, chickenpox, shingles, long-term swelling on the skin, being overweight, and a previous history of cellulitis. Symptoms include irritation on the skin that usually expands. Sometimes it can be itchy. There could be redness, swelling, tenderness, warm to touch, blisters, pain, fever, chills, and dimpling of the skin. Some complications that may arise include osteomyelitis, which is infection of the bone. There could be endocarditis, which is the inflammation of the inner lining in the heart. There could be sepsis, which is a generalized infection. There could be thrombophlebitis, which is inflammation of the vein as a result of a blood clot. And in rare occasions, this infection can spread to deep lining of the tissues called fascia. These actually line the organs in the body and causes a flesh-eating infection called necrotizing fasciitis. Usually this is an extreme medical emergency. To prevent cellulitis, your healthcare provider may recommend preventive antibiotics for you if you are at a higher risk of developing the condition. Other preventive factors include proper daily wound care, application of prescribed protective cream on the wound surface. If you have an open wound, avoid hot tubs, swimming pools, and natural bodies of water such as rivers and streams. Covering your wounds with bandage and change these bandages daily, and watching for signs of infection. People with diabetes or a poor blood circulation will need to take extra precautionary measures in preventing cellulitis. Some of these measures are inspecting your feet daily, moisturizing your skin, regularly trimming your finger and toenails carefully, protecting your hands and feet by wearing footwear and gloves in necessary risky activities, and prompt treatment of infections. Treatment of cellulitis is usually with prescribed antibiotics and other symptomatic management. Ensure to see a healthcare provider when you have punctured or deep serious injuries. Till next time, my name is Nurse Veronica. Bye-bye.